happening with type 1 diabetes is the immune system has decided to start attacking the beta cells of the pancreas. The beta cells are what makes the insulin in the pancreas. The pancreas does other things besides make insulin. It makes our digestive enzymes, it makes glucagon, many things. But in type 1 diabetes, it attacks those beta cells and it decreases insulin production, which means, hey, we're not going to be able to get sugar inside our cells, which is really bad news. We need sugar in our cells for all our cells to go to work.
You're watching the Dr. Jake podcast. Hi, everyone. Welcome back. I am Theresa. I'm a mom. I'm a health nut and a wife to a cancer fighter. And I'm here with Dr. Jake from the Integrative Medica podcast to talk about type 1 diabetes and what your doctor won't tell you. Dr. Jake?
Yeah, so I'm really excited to be able to talk about type 1 diabetes because many people think there's nothing really they can do and they're going to be good just taking their insulin forever and that's all they need to do. And there's nothing else they can do. But in this podcast, we're going to talk about all the other things we can do to really improve patients' outcomes.
Now, you've worked with a number of patients with type 1 diabetes before.
Yeah, so I've been managing patients for a long time. One patient comes to mind. I've been managing him probably for about 7 years now. When he's compliant, he does really well. When he's not compliant, he doesn't do very well. But let's talk about his case a little bit. He's had type 1 diabetes since he was 6 years old. And now he's about 42. Okay. So he's been dealing with it for a really long time. Before coming to me, his blood sugars were really off the chart. His blood sugars were like his hemoglobin A1C was like sometimes it was like at a 14 or 15. So that's really high for those people that don't know. His blood sugar was like in the 200 to 300s quite often. So not managed very well at all. This was him taking his long-lasting and short-acting insulin. So it wasn't being managed very well. So what we looked into for him is we need to look at, okay, type 1 diabetes is an autoimmune condition. So we need to decrease the inflammatory response. So we need to find out what's causing that inflammatory response. So we dived into where there's some potential chemical exposures, heavy metal exposures. Maybe there's some foods that he might be reacting to, maybe some gut stuff going on we need to look into. We also found out that he had some thyroid stuff. He also had Hashimoto's, which is quite common, Hashimoto's and type 1 diabetes. I see it, those go hand in hand quite a bit. So he had those going on. We dived into it. We found that he actually had some heavy metals and we started some chelation on him. We started doing some gut healing because he had a lot of foods that he was reacting to. And we started giving him some probiotics, gave him some glutamine, zinc L-carnosine, N-acetylglucosamine. We gave him some quercetin. And then we started talking about better food choices to eat a lower carb diet, more of a paleo style diet. That doesn't mean eating a ton of bad quality saturated fat, because there is research showing that saturated fat decreases the sensitivity of the cell to insulin. So we don't want to do that, but we do want to get more protein in and more that aren't going to boost the blood sugar. So more paleo type diet that is lower in the saturated fat content and higher in the omega-9s, omega-6s, omega-3 fatty acids to help decrease that inflammatory response and decrease the blood sugar control. And when he is actually following his diet, his blood sugars get in a pretty good range. His hemoglobin A1C, it gets into an 8 from a 15. And then his blood sugar is able to get into the 150s, 120s, which is really amazing for him.
Now, as far as like a typical day, if somebody's really following something that, a protocol that you would suggest, and they have type 1 diabetes, would they see these like high peaks and high lows throughout the day that they may have experienced prior to the protocol, or would they be pretty stable all day?
So if they're following the protocol and actually eating this lower carbohydrate diet and decreasing the inflammatory responses and really trying to decrease the chronic trauma that's still happening to the pancreas, yeah, they won't have these big highs and lows. So the sugar will be maintainable. With type 1 diabetes, you don't make any insulin in response to exercise or to foods you eat or whatever. So you need to manage that. But when you're eating a more lower carb diet, you're not going to have these big spikes. You're not going to be like, oh, wait, I need to take some insulin because my blood sugar is too high. Or you're going to get high and then it's going to go really low and be like, oh, crap, my blood sugar is getting way too low. So I need a pound of brownie now or something like that. So when you're eating a lower carb diet, you don't need as much insulin, which is going to be really great too, because you're not going to gain as much weight. So yeah, type 1 diabetics need it. But if you use way too much insulin, it's going to cause way too much storage. And what storage means is more fat. So
Interesting.
let's say you're taking too much insulin all the time, or you're taking insulin in response to having too much blood sugar, or you're eating tons of sugar in response to sugar being too low, you're just going to get really usually chunky because you're having those blood sugar swings.
Interesting, interesting. Well, okay, so we've got this great case study. I want to I want to really break down a lot of what you talked about. Like you really unpack, what possible causes were leading to it, and then breaking down the treatment plan, which I mean goes all the way down from diet to lifestyle and so forth. So I want to unpack that. Before we dive into that, I do want to just, forewarn our audience who might be listening to this, who might have type 1 diabetes or are a caregiver to somebody who has it, that this is just a podcast, right, Dr. Jake?
Yeah, so this is just a podcast. Nothing I'm going to be talking about today is going to be specific to you. So you need to go to a doctor that's actually going to see you individually and know exactly how to treat you specifically. But if you want to come to me or some of my associates, you can visit our website, integrativemedica.com, and find our phone number and give us a call.
Wonderful. All right, so let's just dive into it. One of the first things that I want to make sure that we understand is, when somebody has type 1 diabetes, what's the problem? What's not working properly in the body?
So what's happening with type 1 diabetes is the immune system has decided to start attacking the beta cells of the pancreas. The beta cells are what makes the insulin in the pancreas. The pancreas does other things besides make insulin. It makes our digestive enzymes, it makes glucagon, many things. But in type 1 diabetes, it attacks those beta cells and it decreases insulin production, which means, hey, we're not going to be able to get sugar inside our cells, which is really bad news. We need sugar in our cells for all our cells to go to work. So when there's too much damage that has happened to the beta cells, you absolutely have to depend upon insulin. And there's nothing we can really do about that. There's no reversing that. Is when you get to a certain point and there's a certain amount of trauma that's happened to your pancreas, you will always have to depend on insulin. But the good thing is you don't always have to depend on a lot of insulin, because that all depends on your diet there. But what happens, so that's completely different than type 2, which is type 2 diabetes, is there's decreased sensitivity of your cells to insulin. You still
Okay.
make plenty of insulin and many times make too much insulin. In type 1, you're making very little insulin.
So would it be
And
safe to say that symptoms might be similar, but it's a totally different cause and a totally different solution?
yeah, symptoms are going to be very similar. They're both going to have high blood sugar, but the treatments are completely different.
Okay. One of the other things that I heard you said that leads me to my next question is that typically when the damage has been done, you're going to be dependent on insulin the rest of your life. So is it possible for someone to catch type 1 diabetes early enough to actually to actually be cured of it if they
There
caught
is
it
that
early?
possibility. Has someone come to me early enough to do that? No, but I definitely think there is that possibility. But usually people get diagnosed this very early on, and kids don't really express themselves very well, telling them that they don't really feel well early enough. And really, honestly, and if they did go early enough, other doctors don't know to really decrease that inflammatory response and stop that immune system attack in the pancreas. So it's just going to get worse and worse. But yeah, if you find it really early and you still have some insulin production, but you're showing that there is decreased insulin production, we could get you on an autoimmune type of protocol to decrease those inflammatory responses. Yeah, and you could get to a point that you might not have to depend on insulin.
So what might be, because I have a friend who wasn't diagnosed with type 1 diabetes until she was 50 years old. Now, I don't know if that means that she had it her whole life and that she didn't know, or if something happened that caused the type 1 diabetes to hit at 50. And maybe you can clarify most likely what it was. But if someone were to be, really paying attention to themselves, maybe a very self-conscious child or an adult, what would be some of the early symptoms of type 1 diabetes?
So you're going to be fatigued, which is very common with a lot of diseases, right? But you could get headaches. You're going to feel really thirsty. You're going to be peeing a lot when or you're not necessarily drinking a lot of water. So those are your skin can start to get really dry. You're going to feel extremely thirsty. Mouth's going to be really dry. So those are some of the major symptoms that you're going to start experiencing. You can start getting constipated also.
Okay. So what about this conception that my friend who happened to get diagnosed at 50, I was under the belief that type 1 diabetes is one that you get when you are a kid. Can you expand on that?
Typically, yeah. So yeah, type 1 diabetes typically is the young diabetes, and type 2 is the older diabetes, even though type 2 is happening in the young all the time now. So that doesn't tend to go there. But type 1 typically doesn't happen when you're older. Now, the question is it really type 1 diabetes, or was it type 2 diabetes? And now the type 2 diabetes got so bad that it traumatized the insulin piece, that too much insulin was being produced by the beta cells. The beta cells decide, hey, we can't make insulin anymore, and they shut off. And then you have to always depend upon insulin. That's still considered type 2 diabetes, but then she was given to type 1 diabetes. So I guess they did order the specific labs to give that diagnosis. She probably had something happen in her life that caused that later in her life. Maybe she had a food sensitivity that she didn't know about, or a gut issue that has just been lingering a long time and had this chronic inflammatory response, and then it decided to start attacking the beta cells in the pancreas. I don't know. Maybe she got exposed to a chemical exposure, or many other potential causes there. A virus, certain bugs you could get exposed to that can exacerbate several autoimmune conditions. So that could have been a piece too.
Now, you mentioned that type 1 diabetes is an autoimmune condition. Is there an understanding of why it specifically attacks children? Why get
I
that
don't
so
think we
early
know
versus later?
exactly why it attacks children. I think children have that issue going on. They have that propensity for that autoimmune reaction. So it's going to happen younger than older, because we don't know exactly. I'm just theorizing on it.
Yeah.
It's just showing up early because they have an autoimmune disease, and usually a lot of times autoimmune diseases tend to show up somewhat earlier. That's not always the
Interesting.
case though.
So you might be in a family that doesn't necessarily have type 1 diabetes doesn't necessarily run in families, but a propensity towards autoimmune, and then it can manifest or show itself in a person and a family member as type 1.
Yeah, so people could have, there could be family members, some have type 1, some might have rheumatoid arthritis, some might have Hashimoto's, some might have multiple sclerosis. But with people with type 2, type 1 diabetes, I many times do see in their history that they have a lot of autoimmune disease going on in the family. Doesn't necessarily mean they have type 1 diabetes in the family, though.
Interesting.
For
So
some
when they
reason,
go
it decided to attack the pancreas.
So when they go see a doctor, a traditional doctor, they're not feeling well, their child's not feeling well, they decide I'm going to take the kid to the doctor. What would be the traditional approach for, most MDs, family practitioners? How would they treat that child with type 1 diabetes and then the rest of your life into adulthood versus more of an integrative approach like you take? Can you expand on that?
They're going to order some of the basic tests to really identify if they do have type 1 diabetes. They're going to check insulin, and then a couple other specific tests to rule out other things, but then they make that diagnosis of type 1 diabetes. And when they make that diagnosis, they put them on insulin. Many times now, they put them on an insulin pump, and they tell them to learn how to manage that well. And many times they tell them that they need to make sure they keep their blood sugar up. So a lot of kids and parents learn that they just need to pound their kids with sugar, which is really the opposite of what we really need to do. It just makes it worse, but it does keep your blood sugar up, and it keeps it from getting into dangerous ranges. But there's those huge fluctuations that can happen. But that's the typical protocol in conventional medicine, is they're going to put you on insulin, but they're not going to give you a ton of dietary advice. And many times they're going to put you on just a typical diet high in sugar, which is not what should be done with any type of diabetes.
It reminds me of that movie, Steel Magnolias. Have you seen it? It was an older movie, but I remember when I
I
was a
think
kid
I've seen
watching it.
pieces of it. Yeah.
Yeah, and Julia Roberts plays a character with type 1 diabetes, and she has an attack, and they give her orange juice, and it
Mm-hmm.
is able to help her feel better. So it's interesting with the sugar that it does, it helps them get out of this dangerous range.
Yeah.
But you
Mm-hmm.
bring up that yes, it helps get them out of this low, but the problem is is that by eating sugar throughout the day in order to keep from this dangerous range, is that it actually creates these high spikes and then actually can cause later another low spike versus
Yep.
actually stabilizing it out. So with an integrative approach, your goal is to stabilize it, and you do a lot of things that doctors won't talk about or won't expand on. Can you please expand? Like, what are some things that the integrative approach really deals with that your traditional doctors do not tell you about, whether for they just don't know or for whatever reason?
So one big thing is, first off, is I'm going to talk to them about diet. That no, we don't want to eat a diet really high in sugar. And what I tell them is you're going to have to modulate your insulin and decrease your insulin dose now, and pay attention to that and see how low you need to go with your insulin, because now you're not going to get as much sugar always coming into your body. But that's going to keep these spikes from happening, and you're going to feel a lot better, and you're going to feel much more energetic. You're not going to have all these sugar cravings that are always happening all the time, and the fatigue and lethargy and the weakness that can happen from this. So when we put you on a more low carb diet, it keeps the sugar trickling in instead of spiking in. And you're like, oh, I need to take more insulin. Oh, wait, I took a little too much insulin. My sugar's too low. I got to take some sugar. When you have this slowly trickling in, your body knows exactly what's going on there. And you're able to have that pump app just manage the trickles, and it doesn't have these big pumps that can happen from that. So, and the less insulin you have, the better, because you don't want to get all this sugar just being stored all the time. It's just going to make people gain weight, and they're not going to have the sugar in their bloodstream to go other places that are needed too. So, yeah, so low carb diet is what I always prescribe for these patients, but it takes some time to get the insulin perfect. I also focus on the autoimmune piece of type 1 diabetes. I want to decrease that inflammatory response, because if they have type 1 diabetes, I don't want too much damage happening to the pancreas, but also there's all kinds of other autoimmune conditions that are likely going to happen if the autoimmune component isn't taken care of. Like they could get Hashimoto's, they could get Addison's disease, they could get rheumatoid arthritis, lupus, or whatever. Many other autoimmune conditions could go with it. So I want to find out what the cause of that is. So I'm going to look at their gut. I'm going to see if there's any chronic infections that might be related to it. Look at their toxin exposure. See if they have small intestinal bacterial overgrowth. See how they're absorbing their foods. Look at their hormones. Look at their thyroid. Look at their adrenal glands. So I'm going to look at all these pieces that have to do with adrenal gland, autoimmune disease, to find out what is potentially causing the type 1 diabetes.
And so if they were seeing you, they might be okay. They're getting their insulin to treat their diabetes. They're on a diet, but they also, if you discover that they've got chronic virus or they have food allergies or some of these other things, they're going to have other aspects to their protocol that are addressing some of these other issues in
Uh-huh.
addition to their insulin.
Mm-hmm. Yep.
Interesting. Now, when you talk about low carb lifestyle, I don't know, like most people, we don't count our carbs. If you were to ask me how many carbs I get in a day, I have no idea. What quantifies really a low carb diet, and what are just some general guidelines as to what that would look like?
Generally, a low carb diet, when you have type 1 diabetes, you do want to kind of carb count, and you get really good at that because you really want to go to manage your blood sugar well. But in general, what it is you decrease the starchy foods in diet. So, starchy foods are things I call squishy foods. So, beans are squishy, grains are squishy, breads, pastas, those are all squishy. Potatoes squishy, yams. So any type of squishy food is really high in starch. Starch is just these links of sugar. So they're going to really spike your blood sugar a lot. So we want to limit those in our diet. And if you do get some starch in your diet, you want to make sure you get fat and protein with that to help that trickle into your bloodstream instead of spike your blood sugar when that happens. So that's in general what it is low carb, decreasing the starchy foods, increasing non-starchy foods, which are meats, nuts, cauliflower, those type of leafy greens, these type of things.
Now, if somebody were to switch to this type of diet from a traditional diet and they have type 1 diabetes, how soon might they start to actually see their glucose levels balance out?
It can be, if they're really following their diet, it's going to be really quick, a week or two.
And so during that time while they're in that transition, if they were to have a drop in their blood sugar, rather than jumping to what they usually might do, which be to, like you mentioned, eat a brownie, Is there something that's a safer way to deal with the drop in sugar or drop in glucose that won't send them just back into the spiral of high spikes and lows?
Well, if they were really in dangerous range, let's say they were in like a 30 or 40, yeah, they need to go get something really sugary like orange juice or soda. I don't care what it is because it needs to be happening really quick. But let's say they're just in like the 60 range, you could go get an apple or a good fruits like that to get your blood sugar up.
Okay. So
So
something
it
a
all
little bit.
depends. You don't want to get in dangerous range because that could lead to bad news.
Yeah,
So you
exactly.
want to
That
get
was
something that's increase the blood sugar real quick. But if you're following this diet, it doesn't happen as much because you're not having as much insulin. The big problem is a lot of people with type 1 diabetes they have too much insulin on board and they could go hypoglycemic.
yeah. That makes sense. Well, thank you so much, Dr. Jake, for just all of your knowledge here on, the things that doctors really don't talk with us about when it comes to treating type 1 diabetes, that it's not just about taking your insulin. There is another way to manage it so that you can have a sustainable lifestyle. Is this something, if somebody's on this protocol, my final question is it possible then to live a long, healthy life with type 1 diabetes?
Yeah, you definitely can live a long, productive, awesome life with type 1 diabetes and feel fantastic. So, um,
Wonderful.
yeah.
So for those people who would like to learn more, and maybe they have type 1 diabetes, maybe they're a caregiver to somebody who does, and they want to dig into, okay, well, why do I have it? What's going on with my immune system? What would my diet plan look like, and so forth? How can they get a hold of you?
So yeah, you can visit our website, integrativemedica.com, find our phone number and give us a call. So we do virtual and in-person visits. So whatever works for you best. And you can set up a visit with me or one of my great associates.
Wonderful. Thanks so much, Dr. Jake, and we'll see everybody else next week.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, MEDICA.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.